This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.
That's number one. You kind of reset me.
Painful, tender to the touch. May also
Same shoulder length, and the other.
Hey everybody, welcome back to another episode of the Real Health Podcast with Brandy and Amir. I am Dr. Amir Rashidian, a chiropractor, and Brandy is Mrs. Chiropractor, the honorary chiropractor. Definitely knows as much as a chiropractor, maybe more than most chiropractors.
He's definitely building me up. I'll take an honorary certificate if y'all want to give it to me.
I'll make one.
You will?
I'll make one. We'll frame it.
It's going to be in my stocking.
We'll put it right here.
Can roll it up and put it in my
We'll
stocking.
have a graduation ceremony.
Ooh, I get to walk the stage.
We get your cap and gown.
Oh my gosh, I'm so excited.
Yeah, I wonder what do they do when like someone speaks at a commencement address and they get an honorary doctorate? Because there's some people who have like 14 honorary doctorates.
Really?
Yeah. Because every time they speak at like a university, especially
Really?
commencement addresses or whatever, then because of their past accomplishments, they get an honorary doctorate.
I never knew that.
You know what you need to do is find out something that doesn't have a PhD program, and then declare yourself as an expert in that field. Remember that we were reporting on an article where the person was like some weird thing.
Yeah.
They had been studying, like they had a PhD in the effect of glass on grass with sunlight.
Yeah,
you know?
like so silly. Yeah.
But that was the real thing. It was an actual department, and she had the PhD for it and everything.
It feels like a lot of extra work. Plus, I just observed this last week.
I'll give you a
Somebody had
raise.
declared themselves the like fourth leading expert in something and were demolished by an actual expert. So I
Yes.
myself am never going to claim to be an expert in something unless I am actually the expert and can back that up, because let me tell you people, there's always going to be somebody else out there that knows a little bit more than you.
Yeah. And then, you know, everyone says chiropractors aren't real doctors anyways.
I can attest to the fact that they are.
Well, we're
I
doctors.
married one.
Depends on your definition of a real doctor.
Well, I would say a real doctor would be one who's, number one, gone through the education and has come out on the other side and is actually helping patients to improve their health. I don't think that you need to have a prescription pad or a scalpel in your hand to be considered a real doctor. I mean, you've actually had as much gross anatomy as pretty much any other field.
The chiropractors get double.
Oh, so more.
So in medical school, you get 2 semesters of gross anatomy where you dissect. We do 4 semesters of gross anatomy. About 7 hours a week in the gross anatomy lab for 4 semesters.
Right. So you guys have what, less toxicology?
Less pharmacology.
Or
We still
pharmacology.
get toxicology. We still get public health. We have more orthopedics, more anatomy, more neuroanatomy than medical school.
That's unbelievable, really,
Yeah.
when you think about it.
Yeah.
So,
And overall credit hours are more in chiropractic school than there are in medical school. So, and we take boards. We take 4 parts of boards. I think they only have 2 parts, but I'm not sure about that.
interesting.
Because we have the last one is the practical board. Because we have to demonstrate that we know
Right.
how to use our hands.
Yeah.
We're basically changing things on the inside of the human body without cutting you open.
Yeah. I think that's a pretty impressive skill. I've never seen an orthopede who could do that.
We're going to pat ourselves on our own backs.
That's right. And if you would like to join us, you are welcome to pat us on the back as well. So we will totally accept that.
Either way.
Is there an icon that you can, like, instead of clap or give somebody a heart, you can like give somebody a pat on the back?
Have it show up right here
Push that button.
or here. And
Sounds like it's always up here. I don't know why they point.
it's always in the corner. They always point to the center.
That's so
it's
funny.
down. Some people say it's down below. I'm not looking under the table. But listen, do you know that a lot of famous people are chiropractors? Have you heard the name Joe Dispenza?
I have.
He's a chiropractor, actually. Most people don't know that. Do you know John DeMartini?
I do. actually.
Chiropractor.
Yeah.
Dr. Eric Berg. Millions of followers on YouTube. Chiropractor.
Dan Pompa.
Dan Pompa's chiropractor.
Chiropractor.
Yep.
Yep.
And Josh Axe,
Yep.
chiropractor.
Yeah.
So these are people you all are listening to already on you know, all the major platforms, and they're brilliant people.
Yep.
But they're all chiropractors. So anyways, hopefully we can give chiropractic a
boost today.
Boost, yeah, a little positive.
Help educate. I mean, the
Media
reality is,
support.
unfortunately, most people don't know these things. So these are little tidbits that are kind of
There
fun.
you go. I think that's the whole podcast for today. We're done.
All right. Well, it was nice for you guys to join us today. We'll see. No, just kidding. We have a couple really cool stories.
We do. So the Real Health Podcast is where we take the latest information that we find on mainstream media, news articles, whatever's being published in mainstream magazines, newspapers, and we read them, we discuss them, then we discuss them with you. We summarize it for you. We tell you what it means and how to apply it to your life. And the purpose, the reason we do all this is so we can help you feel better, get stronger, live longer, and feel younger. So we have a good one that starts out today. This is more of a research article. The information comes from, I believe, the Journal of Nutrition, and it's pretty groundbreaking. Now, this is something that our friends at the FDA will never promote or talk about.
So we will.
So we will. That's right. This is something your medical doctor will never tell you about.
We will.
Guarantee you. This is something you have access to on your own and you can take care of by yourself. And you can put a big dent in the billions of dollars that are being spent on the drug for this condition.
Yeah, and really that's part of why we're doing this, because we truly know that there are so many non-pharmaceutical options that people have if they're willing to do their research and their due diligence. And for me, if you have done all the research and you still land, well, that's in this country, we have the beauty of choice, right? You
Right.
can still choose to take a pharmaceutical, but the reality is not all of us want to do that. Not all of us are willing to risk the effects. You notice I didn't say side.
There you go.
The effects of a pharmaceutical to possibly get the result we're hoping for. Because the reality is you cannot guarantee take a prescription and have the desired effect all 100% of the time. It doesn't work like that. And that's why they have all that big list of effects that can happen, because while we're all very similar, how our body processes things can be changed because of toxicity, because of other surgeries, because of, I mean, there's so many things, our mindset, there are so many things that change how our body processes things.
Absolutely.
And so for you guys to be able to have extra data to go out and do your research and make those determinations on your own, this is empowerment, people. Should be empowering to you.
100%. So
let's
before I
do
read
it.
you the article, I want to tell you that the Real Health Podcast is presented by the Frederick Podcast Network, found on listenfrederick.com, along with all the other platforms.
Yep.
And by the way, a little bit of news. Our previous episode, I think I'm honored about this. This is cool. Our previous episode was mysteriously taken down for reasons that... allegedly told us that we were wrong about something, misinformation of some sort.
Well, no,
So
we were talking about something that somebody else talked about, and because they have a lot more subscribers, their clip got to stay on, but the clip we put of them caused ours to be taken down.
Yeah, so we played a clip of another YouTube video, but it's just a part of it. And so that took us down. But you can still listen to the previous episode on all the other networks, including listenfrederick.com. It will be on that eventually, but you can find it on Spotify and everywhere else. So don't worry, you can still get it.
And if they took it down, there's some good content.
It's got to be good.
Guys.
There you go.
So
It's
make
gotta
sure
be
you
good.
go to the other platforms and listen to that. You can also go to Listen Frederick,
Yeah.
and you'll see the episodes hosted there as well.
Yeah,
So,
eventually we want you guys to just mainly use listenfrederick.com. As we start to transition more and more of our episodes over to them. So here's the article. It says, ancient spice saffron works as well as Ritalin for ADHD.
this is so exciting. You want to know why?
Tell me.
I have access to tons of great saffron.
Oh, yeah.
It's one
You
of my
know,
favorite spices.
Per ounce, it costs more than gold.
Yeah, yes, I do, because we got a huge amount as a wedding gift. Do you
Yeah,
remember?
we still have it.
From Dr. Nazemi.
Yeah.
And no, we're done with that.
We used it?
Oh, yeah.
No wonder we don't have ADHD.
He doesn't cook. Can you tell?
No wonder we don't have ADHD.
That's right.
We eat too much saffron.
And we're happy.
The spice
That
saffron
also
has been
helps.
found to offer comparable efficacy with the added benefit of better sleep. Groundbreaking study published in the journal Nutrients found a botanical extract of the ancient spice saffron works as well as methylphenidate, brand names Ritalin and Concerta, to treat attention deficit hyperactivity disorder in children and adolescents. In the U.S., millions of children have been diagnosed with ADHD, including 3.3 million 12 to 17-year-olds, 2.4 million 6 to 11-year-olds, and even this one blows me away. 265,000 3 to 5-year-olds. Shouldn't it be like 100% of 3 to 5-year-olds? You ever see a non-ADHD 3-year-old? Show me a non-ADHD 3-year-old.
No, I 100% agree. I think
Ridiculous. What did they
when
test?
children are so
there's no
young-
blood test for ADHD.
There's
You
not.
look at the kid, you go, oh yeah, definitely hyperactive.
Yep.
Yep, this kid has
Made
no
it
attention.
he made it halfway up the wall.
This 3-year-old can't do calculus yet.
Yeah. So, and I know we're joking a little bit about this, right?
Oh my
Because
gosh.
I fully understand our one of our children, when he was a toddler, was definitely more active than the others, right? So I started doing research because the biggest thing and one of the most important things to us was not unnecessarily giving our children a label that would stick with them for the rest of their life. And because we do that a lot in our society. And I just wanted to make sure that we weren't jumping the gun, because then in our society, with the huge push for pharmaceuticals, what ends up happening is we end up labeling a child, and then they get into the system, whether it's school or wherever, or they're going to their doctor, and this becomes a topic of discussion for pharmaceutical use. In my opinion, far too young. What a lot of parents don't know, and what we found in our research, is because toddlers are so difficult when it comes to food, right? Has anyone had my kids, before they actually got a mind of their own, they would eat whatever I placed in front of them. Majority of the time. They became a toddler, and all of a sudden the things they loved, they no longer loved. I was beside myself. I was like, what am I going to do to feed these kids? And so I started researching, and what we found is mineral deficiencies in children often mimic ADD and ADHD symptoms. I don't know about you guys. My children on the norm were not eating sea kelp.
Yeah, where do they get minerals? It's vegetables.
Vegetables, yeah. And
Things that take mineral from the ground to grow.
yeah. Well, then you're dealing with a whole soil issue, which we're not going to get into.
Not today.
We'll let our
We'll get in there.
deal with that, and there will be a
get
lot
dirty
of
later.
studies. Yeah,
Yeah.
there's going to be a lot of studies coming on that. But if our soil's not good, right, then can we expect our vegetables to have those minerals in an amount that our kids need? I'm just going to tell you the answer to all that is no. You're not going to get it. So you have to do some kind of supplementation in order to help bridge the gap. Now, there's a lot of doctors out there that are going to say, you don't need supplementation. I'm going to tell you they're wrong. They're hoping to push you to pharmaceuticals. I'm trying to help you
Like
do
they have
this
a
without.
deficiency of Ritalin in their body.
Nobody has a deficiency of Ritalin. Nobody has a deficiency.
I mean, you compare the two, which makes more sense? A mineral deficiency or a Ritalin deficiency? But they'll push that and say, oh, the mineral thing is... By the way, minerals aren't approved by the FDA.
Don't worry, they are by God. Okay, so
And
moving
that
on.
label thing too.
Oh, yeah.
The label thing. You label a child, that goes with them. The only label your child needs is loved, child of God, valuable.
100%.
Those are their labels.
Yep.
That's the label they need.
Yep.
The percentage of those taking powerful medications as a result varies by state, but ranges from, so some states have more hyperactivity and attention deficit. Interesting. Ranges from 38% to 81% of those diagnosed. So certain states, 81% of their kids that are diagnosed are on these drugs. Overall, however, it's estimated that 62% of children with ADHD take ADHD medication. These are psychotropic drugs.
Yeah.
Side effects from these drugs can be steep and include weight loss, difficulty sleeping, anxiety, along with a rebound effect in which fatigue, poor mood, or increased activity occur as the medication wears off. Other side effects include tics, growth delays, stomach problems, and changes in blood pressure and heart rate.
And for the record, those are the short-term side effects. Those are not the long-term effects, because we know that the government does not allow someone to enlist if they've been on some of these medications for 10 or more years, because it actually changes the brain mass. So the brain actually changes, which means, and the worry with how these particular medications change the brain is it actually makes them more susceptible to violence. They're not even allowed to carry guns. That's why they're not allowed into the military. So, and that was standard for years. And
I mean,
I don't
wouldn't
know
want
if that
someone
has
on a
changed.
psychotropic drug carrying a gun.
Right, 100%.
As noted by the study authors, while psychostimulants remain a go-to treatment for ADHD, parents tend to be reluctant to administer them due to side effects.
Good job,
And
parents.
alternatives are needed. Saffron, it turns out, may provide one valuable option.
How cool is this? And let me tell you guys, you have nothing to lose. Like, you have nothing to lose by going and getting some great high quality saffron and
So
giving it
the
to your
company
kids.
Gaia Pro, now this can only be distributed through professionals like chiropractors, but has one that came out recently.
That's awesome.
And we actually we have it at the South office.
That's very cool. Let's test it.
The doctors, we all took one.
How'd you feel?
We felt good. Actually, this is what I know from way back when I was a little kid. Because in Iran, rice always has saffron on it, and makes it
Put
amazing.
a picture of some good Iranian rice. I'll send you one, Sean. We'll make everyone hungry.
So there's always saffron on your rice, and there's rice with every meal in Iran,
Every
except breakfast. You have rice with lunch and dinner, and they always said saffron acts like laughing gas. It makes you laugh.
Yeah, your family used to tease me, and they would say that they used to use it as not your family, but it was used as a torture device because it would make people laugh, uncontrollably. So I'm pretty sure that's not true, but that was a really fun.
Yeah. So anyways, so maybe I wonder what the rates of ADHD are in Iran versus other countries.
We should look that up.
Yeah, I bet it's less. The study involved children and adolescents with ADHD aged 7 to 17 years. Group 1 received psychoeducation and extended release methylphenidate, while Group 2 received psychoeducation and saffron at a dose of 30 milligrams a day for 3 months. Interestingly, while those taking methylphenidate, which can cause sleep disturbances, took the dose in the morning, those taking saffron consumed it in the evening due to the well-known properties of saffron in improving sleep quality, latency, and duration. Both treatments led to statistically significant improvements in core ADHD symptoms and executive functions, which include inhibition, working memory, multitasking, and the ability to monitor one's own actions.
Guys, that is so cool. Those results are groundbreaking for those parents who really, really, really just cannot see themselves allowing their child to take a medication like what's available right now. This is showing such promising opportunities for us. I'm so excited.
I can hear the phone ringing right now. The attorneys are calling. They're saying, say the disclaimer. So if your doctor prescribed medication for you, you need to follow your doctor's advice and do what they prescribed for you.
Until you have a conversation with them, and go have a conversation with them.
Talk to them. Show them this study. But listen, we would never, ever tell you not to follow your doctor's advice. Something's been prescribed for you. Research it, then talk to the doctor who prescribed it, and have them take you off of it if it's safe.
Yes.
Properly. Don't just listen to this and stop your meds and start taking saffron. Do it the right way. All right. And certainly
there can be negative effects by stopping something, a pharmaceutical, especially something that has psychotropic effects. So just make sure you do it properly.
We just read it. There's side effects to taking it, and there's when you're coming off of it, you have certain effects with that too. It says the improvements were comparable in terms of efficacy, measured with both pen and paper tests filled out by parents and subjective measures. While no significant side effects were reported in either group, those taking saffron enjoyed an additional benefit of better sleep. According to the study, a pronounced difference was found in the saffron arm in the sense that the parents of the children treated with saffron reported a pronounced improvement in the time to fall asleep. What's more, the study found saffron tended to be more effective than methylphenidate for treating hyperactivity.
Gosh.
Saffron is the dried stigmas from Saffron crocus or Crocus stivus, well known for its anti-inflammatory and antioxidant properties. It's been used as a remedy for chronic diseases, including rheumatoid arthritis, inflammatory bowel diseases, Alzheimer's disease, and cancers of the colon, stomach, breast, lung, and skin.
It is so cool.
In addition to showing promise for modulating high blood pressure and improving lipid profile, saffron compounds such as crocin, picrocrocin, and saffronol appear to have protective effects on the central nervous system, along with psychoactive properties. Quercetin, for instance, is known to penetrate the blood-brain barrier to reach the central nervous system, leading researchers to suggest it can be effective for neurodegenerative disorders. What's a neurodegenerative disorder? Alzheimer's.
Yeah.
Further, saffron has antidepressant and anti-anxiety properties, which researchers suggest are similar to those of current antidepressant medications such as fluoxetine, imipramine, and citalopram. Good luck. But with fewer reported side effects, naturally. Saffron affects NMDA and GABA receptors in the brain, leading to the secretion of dopamine, serotonin, and noradrenaline, according to the nutrient study authors. So everyone needs more serotonin and dopamine. You can get some dopamine by eating chocolate, but then you adapt to it. Saffron's better for you, and no sugar. Given that first, both dopamine and noradrenaline are the core neurotransmitters associated with ADHD, the second, saffron extract is a safe, natural substance, thus alleviating parental fears regarding the stimulant drug-based treatment of ADHD. It seems plausible to test whether saffron has some potential to treat ADHD.
Why do they say that? It is plausible. They just said it's plausible.
Maybe their attorneys told them to say it like that.
It's just really funny. I'm like, it does all this. So it seems plausible to test whether saffron, you just tested. You just tested. It's okay.
Yeah. So it says at greenmedinfo.com, which is where this article came from, you can find 141 diseases that saffron may benefit, which include not only depression, anxiety, and Alzheimer's disease, but also type 2 diabetes, erectile dysfunction, and macular degeneration, among others.
So cool. I just think it's really neat that we're finally seeing, and I think also with who's going to be making some changes within the FDA and, and some of these other governmental groups, which haven't really been as good at protecting us as they should be. I think we're going to see more and more of these studies come out because it's going to be okay for that to happen. Do you know what I mean?
I agree.
And for us to know that there's tons of, there's a time and place for medication. We've always said that. There's a time and place for surgeries. If you're in a car accident and you're here and your leg is there, please get yourself some pain meds, go in, get surgery, have that reattached. That's what it's there for. It's an emergent care system is what we have. What it is not is a wellness care system. It's not a true healthcare system. We have a sick care system. And so until we're ready to just acknowledge that and know that right now the system is set up to feed the pharmaceutical companies and insurance groups and whatnot, you have to know that your best interest is not in their hands. That's not their goal. So you have to be your advocate. You have to do your research and just know that God gave us tons of stuff that can treat the illnesses that we've created in our world, because these are really a lot of our things that we have to take medication or supplements for. Unfortunately, it's caused from just how our culture has developed over the years and the toxicity levels and our food sources. And so it's time, I think, to go back to what's natural and see if we can't fix some of these things that have been broken by a broken system.
I agree. I have a theory on ADHD. Do you want to hear it?
I love theories.
So, ADHD are kids who can't pay attention, who are hyperactive. So you go, well, why are they hyperactive? Number one, if they can't pay attention. Why did the two go together?
Right.
Secondly, why is it that you give someone a stimulant and they calm down?
Right.
Right? Where if you and I took the same stimulant, we'd probably stay up all night, clean the house 3 times.
Let's do it. No, sorry. Just kidding. We're not going to, but I do have a lot of stuff I need to pick up.
Our next article will be about marijuana.
Let's do it. No, I'm kidding. Okay. Keep going.
We'll do that too. We got to test everything we tell you guys about. But listen, here's my theory. And listen, I want to tell you, just like the last podcast that got taken down, I said it from the beginning. These are our opinions. Take them as you want. Research it for yourself. See if we're right. It's an opinion. My opinion on ADHD is this, that these kids are not receiving enough stimulation to the brain. Their brain is understimulated.
Correct.
For their brain to receive proper stimulation, they have to constantly move their arms and legs.
Right.
That's why they fidget and move around all the time. They can't sit still, because if they sit still, the brain goes, I'm not getting enough stimulation.
Correct.
Something is blocking the flow of input from their body to the brain. So you pump them full of a stimulant, which revs them up, and all of a sudden the brain goes,
there you are.
I'm finally being stimulated. I can sit here and pay attention. So it's not hyperactivity. Their nervous system is hypoactive.
Yes.
It's not active enough. That's why they have to move their arms and legs to increase that activity so the brain gets stimulated enough. So we can do one of two things. We can remove what is blocking the flow of information to the brain, or we can just keep stimulating the kid.
Just to let you guys know, there's no surgery involved in removing that block. It can be done without that. It's actually very simple and safe.
If it's a brainstem tension or misalignment in the occipital-atlantodental misalignment, which is the top 3 parts of your spine, skull, C1 and C2, that can affect the brainstem, and that can cause ADHD symptoms. Correction of that can reduce that, and stimulation can flow to the brain. Other things can do it too. Obviously, there's chemical imbalances and all kinds of things. Just like we know, like our son doesn't have misalignments in his upper spine, but he needs the minerals because he would not eat vegetables. So we had to give him those minerals in the form of a supplement to calm him down. Also, anytime he touches red dye, he flips out and becomes super hyperactive, and that's another one. So I'm not saying this is a cure-all, but I'm telling you there are other ways to stimulate children. Exercise is a big one. Proper nutrition is a big one. And then chiropractic care is a big one.
And pharmaceutical use should always be our last resort.
Yeah, if nothing else works.
Correct. But if you've tried everything, you've gone the physical route and you've tried things more holistically, and it's about quality of life, and you know what I mean? That's how these decisions really should be made. But jumping over all of the natural things that can allow the body to do what it was designed to do.
Do you remember Riley? We had a patient named Riley. How old was he? 11? I think he was 11. He was 5th grader.
Yeah.
He was in 5th grade. He's 11 years old. This is years ago. Our office was downtown Frederick at the time. And so his parents had put him on one of these ADHD meds, and they said his personality changed.
Yeah.
His sense of humor disappeared. He was anxious. He wasn't sleeping well. They took him off the meds, but he still had ADHD, and they were like, we got to do something else. So then we're like, well, let's try chiropractic. And so he came in, his first adjustment. Do you remember this? He's lying on the table. I explained everything to him. I said, listen, we took an x-ray through the mouth and from the side and from underneath, and we wanted to see where that C1 is lined up. So if it's misaligned, I had it measured. I knew what angle, what degree, how many millimeters it needed to move. And so he's lying down. I explained the adjustment to him, and I said, listen, you might hear a little pop when I do this adjustment. Just stay where you are. And so I did the adjustment. His spine made the biggest noise, just big, loud pop. This kid jumped off the table, ran as fast as he could, ran out the front door, went onto the sidewalk, ran down 3 blocks before we caught him.
This is not normal.
That's
That's not the normal response.
That's why I remember Riley specifically. And so we finally caught him, brought him back, and we said, "Hey, you okay?" He's like, "Yeah, I'm fine." Don't run. It makes you look guilty. Never run. Put your hands up. Anyways, but yeah, and ended up that his ADHD disappeared completely.
Yeah. They were able to remove him from medication, and man,
Yep,
such
no
a
more,
blessing.
no more meds. Everything worked well. All right. So, I mean, there's more in the article. They talked about how the study was done. The first study they said was not randomized, meaning participants were able to choose which treatment group, saffron or methylphenidate, they wanted to be in. So some said, I want to do this. Some said, I want to do that one. This increases the risk of selection bias, which is one of the study's limitations. However, this isn't the first time saffron has been highlighted for ADHD treatment. In 2019, a 6-week, this one was randomized, double-blind study found similar benefits for saffron on ADHD. The participants were randomly assigned to receive either 20 to 30 milligrams of saffron or 20 to 30 milligrams of methylphenidate, depending on how much they weighed. Both treatments worked equally well, suggesting saffron was as effective as Ritalin for ADHD. This study provides evidence for satisfactory outcomes with saffron in treatment of ADHD, the researchers noted, adding that saffron contains nearly 150 different components. In addition to offering benefits of ADHD, saffron has at least 75 known pharmacological actions, including anti-tumor properties, which is why it said it's good for cancer, and radical scavenging capability. Saffron may be useful for enhancing learning, memory, and sexual activity, while offering benefits for schizophrenia and Parkinson's disease, along with anti-convulsant effects.
So basically, it's covered. I think it's pretty much good for everybody. I mean, if you look at the vast number
Certainly
of things that, I mean, overall, anything that's anti-inflammatory, like all of us can use, because inflammation is something we struggle with in the United States no matter what. There's probably very few people who don't deal with inflammation just because of our food.
Yeah.
Like if you're eating any kind of fast food, if you're eating any kind of processed food, carbs, sugar, any of that, that creates inflammation in the body. And so, being able to, and inflammation is one thing, it's a precursor to disease. And so, chronic, especially if you're dealing with chronic inflammation. So just make sure that you're looking at things like this and incorporating easy things into your diet every day that can just help improve your overall health and well-being. So if nothing else, hopefully you'll get that from that article. But there was more, just in case you missed it.
Absolutely.
All right, you want to talk about pot?
Yeah, let's talk about pot.
All
This one's
right.
from New York Times.
Yeah. This is, we've had several articles that have come across our desk over the past year as marijuana laws and usage have changed majorly for the vast majority of states across the country. One thing that has come up is there's several health conditions that our emergency rooms are saying that they're seeing more of, that we're going to discuss with this. I think it's really funny that as I guess we're legalizing marijuana, there's been some kind of thoughts and discussion about this not being addictive. Drugs are addictive, people. Just know there's very few things drug related that you're ever going to put in your body that are not going to be addictive. And so I would always weigh on the side of, could this possibly create an addiction? That's probably what you just want to, your bouncing off point. Even if a study says it's non-addictive, I think that's silly. So I think it's going to be. Anyway, let's see. The drug, legal in most of the country, widely seen as non-addictive and safe. For some users, these assumptions are dangerously wrong. The reports are continuing to examine cannabis policies, the use of the drug, and the rise of the commercial market. If you have a story or information to share, they want to hear it. So, but it's fine. We'll have our own stories. In Mid-Coast, Maine, a pediatrician sees teenagers so dependent on cannabis that they consume it practically every day, a remarkable, scary amount. From Washington State to West Virginia, psychiatrists treat rising number of people whose use of this drug has brought on delusions, paranoia, or other symptoms of psychosis. And in the emergency departments of small community hospitals and large academic medical centers alike, physicians encounter patients with severe vomiting induced by the drug, a potentially devastating condition that once was rare, but now they say is common. Those patients look so sick, said the doctor in Ohio, who described them writhing around in pain. So what they're talking about is when it comes to the vomiting, is it's a disease process, or a condition, I should say. It's not a disease, called CHS, which is cannabis. Let me see. I just lost it. I'll get it for you here in a second. I can't believe I just lost my place. Okay, I'll continue on. So funny enough, this CHS condition that causes this vomiting, one of my best friends, her husband, actually encountered this years ago. They live in Colorado, and they were participants in using that, and he used it for many, many, many years, and developed this situation where he was really sick, and he was having these stomach issues and was vomiting all the time, and they could not figure out what it was. And it took a really, really long time for him to be diagnosed. And the only way he could come out of that condition was to stop using cannabis altogether. And so this is something that what they're finding is it affects probably about a third of the population. So it's something that people need to be aware of, that this is a potential that a vast number of people are experiencing. It says, as marijuana legalization has accelerated across the country, doctors are contending with the effects of an explosion in this use of the drug and its intensity. A $33 billion industry, wow, has taken root, turning out an ever-expanding range of cannabis products so intoxicating they bear little resemblance to the marijuana available generations ago. Tens of millions of Americans use the drug for medical or recreational purposes, most of them without problems. But the more people...
It's not bigger than cigarettes, right?
Probably not, but it may be overtaking it. But with more people consuming more potent cannabis more often, a growing number, mostly chronic users, are enduring serious health consequences.
Cigarettes is 900 billion.
Yeah.
So this is 33 billion.
It's really sad that we're encountering this. I have issues with a couple of things. First of all, I do not believe, even though something is natural, it is a natural substance that has a drug-like effect on the body. We should not be experimenting with that in children and teens, no matter what. They are still developing. It is a drug, so there is an addictive potential there. And why are we allowing kids to do this? Like, I don't understand. Never, even if my child was diagnosed with ADD, ADHD, I can't imagine allowing that to happen. But that's me. But I'm very, very cautious about what our kids put into their bodies. So about 18 million people, nearly a third of all users ages 18 and up, have reported symptoms of cannabis use disorder. According to estimates from this unique data analysis conducted for the Times by Columbia University epidemiologists, that would mean they continue to use the drug despite significant negative effects on their lives. Of those, about 3 million people are considered addicted. That's enough. The estimates are based on responses to the 2022 U.S. National Drug Use Survey from people who reported any cannabis consumption within the previous year. The results are especially stark among 18 to 25-year-olds. More than 4.5 million use the drug daily or near daily, according to the estimates, and 81% of those users meet the criteria for that disorder. That means almost everybody that uses it every day is reporting problems with it. Okay. Said Dr. Wilson Compton, Deputy Director of the National Institute on Drug Abuse, who was not involved in this analysis. This is a very clear warning sign. Marijuana is known for soothing nausea, but for some users, it has the opposite effect. Okay, so I'm getting ready to read a story about a woman, a hairdresser named Jennifer, who's from Illinois. She turned to a drug in her 40s when her doctor suggested it would help her with her severe migraines. Starting in 2019, whenever she felt a headache coming on, she would take a hit of a marijuana vape pen and pop an edible from the medical cannabis dispensary, and it worked. But after several months, she developed stomach aches. A dispensary employee advised upping her intake, and eventually she was using the drug nearly every day. Within months came episodes of nausea and vomiting, so debilitating that she had to stop working. Okay, couple things that you just need to take note of. Number one, don't take advice from somebody who's just works at a dispensary. Make sure that you're taking the advice of a medical professional who knows your health history and knows what the effects are, especially if there's any other pharmaceutical use, which is very common with migraine patients. Number two, we have reported many times on vape pens. There is nothing safe about them. There is nothing healthy about them. There are additional chemicals that are highly addictive and highly toxic. So within this example, there's a little bit more to it than just straight cannabis use. It's and not that I'm saying one is okay over the other, but there's a big difference between cannabis flower that's unadulterated and using a vape pen. So just take that into consideration because we're talking about other chemicals that are involved that can also induce things like this. This is what kills me though. After searching online in 2022, she suspected.
Do you want to tell them about the misdiagnoses?
Oh yeah, I'm sorry.
It says about a dozen doctors misdiagnosed the problem. One removed her gallbladder, another her breast implants. Several chalked up her symptoms to menopause.
Yeah. And I was going to point out, this is my biggest issue with our medical system as it is that number one, doctors don't always talk to each other. They also don't always see the notes or documentation was not done properly. And so they don't have the right information to be able to treat the patient. And number two, why the heck are we ripping stuff out of the body before we're like taking out things from our diet or taking away pharmaceuticals? For me, take me off of everything. Like, make sure my diet is 100% clean.
That's what happens in hospice.
Medications.
How many people are put on hospice? They stop all their meds. All of a sudden, they come back to life.
I've seen it because I worked in a nursing home, and I think I shared this on a prior podcast, but we had a lady who was in the nursing home, and she was catatonic, and we had to get her out of bed. She couldn't ambulate, she couldn't feed herself, she couldn't speak, nothing. I mean, she was 100% catatonic, and every once in a while, they will strip the patients of all their meds, see what's needed, and then, put them back on. When they stripped her of all her meds, it took a couple days for everything to work out of her system. That woman was sitting up. She was talking. She was able to feed her. I was blown away. She came to life. She was dead and came to life. I'm not saying literally, but she had no quality of life. What do you think they did?
Put her back on the meds.
Sure did. So sad. Okay. So this woman had several surgeries and still nothing. After searching online in 2022, she suspected she had cannabinoid hyperemesis syndrome. There it is. Sorry for my I'm going to take some saffron when I get home.
It's not a common word, hyperemesis.
It's not. And I had a different word in my head and I didn't want to say it wrong. But, saffron's going to help me. I'm going to go have a big dose of that when I get home.
We're going to start on saffron. That's right.
I can't wait. Hyperemesis syndrome, a condition caused by heavy cannabis use and marked by nausea, vomiting, and pain. It can lead to extreme dehydration, seizures, kidney failure, and cardiac arrest. In rare cases, it causes death. Which they're probably saying when it goes misdiagnosed and it continues on and somebody doesn't come off of their the cannabis, then it will lead to that eventually, or could lead to that. At least 8 in the United States, including some newly identified by the time. So they're saying there have been a few rare cases, but possibly 8. Since the syndrome was first documented in 2004, doctors say they have observed sharp rises in the case. Well, that should not be surprising with the sheer number rise in the number of people using cannabis. So this is one big issue. The article goes on to talk and give some additional information. This young lady who was suffering from this and had these surgeries and then figured it out on her own, she felt angry that the doctors hadn't caught this because she suffered so much.
I'd be angry too. She went through multiple surgeries for nothing.
I also agree, but to a certain point, because I cannot say this enough. How much do you question what people tell you?
Yeah, that's true.
Because all of this information is at all of our fingertips. And I feel for her 100%. And is there a culpability on the physician's part? 100%. But there's also culpability on our part because I have to be my own advocate. I have to be my own doctor. I have to do my own research. And if I'm not willing to do that, and I am 100% putting my trust in a system, in a person I may or may not even know, then I have to accept whatever risk comes with that. Mm-hmm. I cannot refuse to do my own research and make my own informed decision or require the data from my doctors that I need or ask for the tests. I can't refuse to do that and blame somebody else. I'm sorry. It does not work that way. So should you be upset at the doctors? Yes, but that is a shared responsibility. Yeah. But I'm a big personal responsibility person.
Yeah.
in all areas
of life.
Do that with
what we tell you also.
100%.
Everything you hear here on the podcast.
Yes.
Go research it yourself.
Yes, absolutely. So, this just goes on to talk about the some of the legality in, bringing cannabis and making it possible. Some of the biggest issues is that there's such high doses because with almost anything, once you start taking it, your body gets used to it. And then you have to, in order to get the same therapeutic effect, you have to increase your dosing. Well, I think what we need to be teaching people, I think marijuana can be helpful in some conditions. But I think that there's a responsibility with people being able to manage this properly and saying, okay, maybe I need to say, when this no longer feels effective, I take a break for a few weeks or for 30 days, let this come out of my system and then come back into using it again if I still feel like it's necessary. We're really big on any supplement that we give someone, it's typically not to be used for the rest of their life. It's for a season. And so if it's for a season, we need to say, okay, try this for a little while, come off of it, see how your body responds. And if you need it again, then we'll prescribe you another round, right? That to me makes more sense. The other issue that they're finding with cannabis is not just the cannabinoid hyperemesis syndrome, but it's also there's a psychotic challenge that's also popping up. So people are saying that they're having psychotic breaks almost, if you will, and people are seeming like they're almost possessed. The challenge, again, that I have with some of these cases that they're talking about is that, like this one gentleman, he was a military veteran. He had PTSD, and then his cannabis usage caused hallucinations and caused a psychotic or temporary psychosis, I should say.
He needs saffron.
Saffron could very, very much help for him. But also, there's so much more to that, right?
Yeah. Oh, yeah.
Like, we don't know what he was forced to take
Right.
as a military officer or as a veteran,
Oh, yeah.
what he was exposed to, both physically, toxically, from a toxicology standpoint, food standpoint, and also mentally and emotionally what they're exposed to.
Right.
So I think it's while I feel for this guy, and I think it's really sad that he had these experiences where he was having all of these hallucinations. Yes, cannabis may not be good for him. I don't think that's the vast majority. And they even say in this article that there's the rate at which this occurs, the psychosis, is very rare. But I think if you've had a lot of these other things that have gone on, and you have PTSD and you have other issues, maybe that's not something you should try, or you should try in huge moderation. So I think that's probably the biggest thing when it comes to this article. It's a very long article. They talk a lot about, if you can't sleep, you can't eat, you can't focus, even while taking the cannabis. Cannabis for some people can have an opposite effect of what it's supposed to. Any medication, any supplement is going to be like that. So I still say be cautious. I don't think we should be letting kids take this at all. I think you need to make informed decisions. And if this is something that you want to try, do so, under the supervision of a doctor. I still don't think something like this I'm not huge on recreational usage.
Right.
I think if it helps somebody who has a medical condition and they're not experiencing these other things, I have less of an issue with this from a medical standpoint than I do opioids. But again, I'm looking at the effects of the two drugs for the vast majority of people, but it still can be addictive. It still can have some other issues. So you have to make sure that you're making the right decision for you.
Absolutely a no-no from a recreational standpoint.
Yep.
If it's recommended by a doctor, monitor your symptoms, keep a journal of how you feel every time you smoke or, take a gummy of some sort, and just keep an eye on yourself. You should get regular blood work done. Being healthy is work.
It is.
And we're going to talk about it a little more with the next article on the next podcast. So please join us on that, because we're going to dive deep into a few things. We saw an article that said 3/4 of U.S. adults are now overweight or obese, and they call obesity a disease. I say it's a byproduct of disease. It's not its own disease. But
it's also a byproduct of habit.
It's a byproduct lifestyle, so we need to talk about these things. And then they want to make obesity drugs covered by all insurances, including Medicaid. And we have some information about blue zones and so on. So we'll go over those next time. But I think two major things was saffron and marijuana. And hopefully that was useful. And please join us again next time. Remember, we are presented by the Frederick Podcast Network on listenfrederick.com. And we just appreciate you greatly if you can subscribe, if you can like, if you can share. We will continue to bring you the latest information on health and wellness. God bless. Take care.
Thanks.
This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.